Welcome to Whiteboard Wednesday. I'm Tripp Johnson, CEO of Greenhelp. Today we're going to talk about one of the most important aspects of leadership, creating a cohesive vision. So, as far as leadership goes, it can be broken down into three categories, three core functions: providing direction, ensuring alignment, and garnering commitment. Today we're going to talk about direction and specifically, what it means to create a good, cohesive vision. So one of the most important aspects, like I said, is creating this vision. For those of us in the healthcare industry, our day-to-day job can often get divorced from the change we're trying to create in the world. And what's really important is that everyone in the organization understands what the vision is, because that's really why they signed up to work in this field. So when you're thinking about crafting a vision, you need to ask yourself, how are you changing the world? Steve Jobs said he wanted to make a dent in the universe, and that's kind of what we're going at here. It needs to be aspirational. Your organization doesn't exist just to make widgets. We're here to make a difference, and you need to articulate that to everyone. It's going to be motivating for your team, it's going to attract the right clients to you, and it's really going to be the backbone of your leadership context. They need to know where you're going. As a leader, it's your job to live in the future. And creating that vision is the roadmap that you're using to bring others along with you. So first, when you're thinking about vision, answer the question, what is the change you're trying to make? How is your organization fundamentally changing your community, the treatment field, whatever it is? We always start with in 10 years, ... So in 10 years, if you've accomplished your mission, what's different? What does it look like? You need to be specific and paint a clear picture in the minds of everyone. They should understand what this means. They may not understand how you're going to get there, and you don't even know exactly how you're going to get there, but it is important to know what you're trying to do. Another component of this is aspirational. We're an addiction and mental health provider. We're not building rockets to go to Mars, so we're not talking about cutting edge innovation and how, what we're going to do in that regard. But we are aspirational. When we talk about our vision at Greenhill, we're talking about how the difference we want to make in the treatment field, how we want to make top quality treatment more accessible. One of the big things for us is developing a curriculum. So we think that, developing resources for both our team, for their own development, for our clients or patients, for their development, that's going to be really important in making more egalitarian healthcare possible. Right now it's really expensive to get the treatment you need, and part of our vision is to make it more accessible. And to do that, it's going to be about curriculum. Now, we talked about developing a Greenhill model for years, but that really didn't start to take shape until the last 6 months. Even though our vision statement had said, in 10 years, there will be a Greenhill model. We didn't know exactly what that meant, but that has served to be kind of the North Star for us. Everything we're going towards is aligned behind the fact that we need a better model of care for our clients. So I hope it's clear that a vision is incredibly important. Your first task as a leader is to create a clear and compelling vision for your team. That will help you get the right people on board. So now, next week, what we're going to talk about is the alignment piece, and that's going to be about values. So it's one thing to have a vision, and that's kind of your map for where you're going, but your values, that's going to be your compass. That's going to keep you on track. So I hope you tune in next week for Whiteboard Wednesday. Thanks for watching.